Welcome to City Week, ladies and gentlemen. Today I have a guest on that everybody knows in our community, and we are so glad that she's back on again to share some much needed information for our community. So everybody, get your listening ears on, because I am joined by none other than Dr. Baker. Dr. Baker, welcome to the show.
Such a pleasure to be back with you again.
Yes, it is. You know what? I dread that we didn't have the cameras rolling a moment or two ago, because you were giving some information that I know I'm not going to be able to cover it all, but we're going to definitely dive in here.
Okay.
Because it's something that's needed here in the community. But Dr. Baker, before we get started, if you don't mind, tell us just a little bit about yourself.
Well, I'm Dr. Joy Baker, and I have been working as an OBGYN for 15 years now.
Wow.
For the last 5 years, though, I've been back here in LaGrange, where I was born. My family's here, so I'm happy to be back. I currently serve as the department chair for OBGYN and pediatrics at the hospital at West Georgia Medical Center, and then as the quality safety director. So my job is really to make sure that we are the safest place for women to receive care. So that I'm on a mission.
There you go. Absolutely. The safest place for women to receive care.
Yes.
Why is that so important?
Well, you know, I think that many of us have seen in the news that we do have a maternal health crisis that's happening across the United States, but particularly in Georgia. We are in the bottom 10 for the nation in terms of maternal care delivery. And so we have moms that are dying, and we also have an infant mortality problem here in Georgia as well. And so we are really working hard to do that. And in fact, our hospital here in LaGrange is actually the safest WellStar hospital in the state in which to have a baby. So we're super excited about that.
Congratulations. And I'm sure that takes a lot of work to get to that status.
It does, but I'm good at working hard.
There you go.
And I have an amazing team of physicians and nurse practitioners and certified nurse midwives and our nursing staff. So we have all been working very hard to turn the tide and make sure that our moms in Troop and surrounding counties are safe.
Well, thank you so very much for that. And you know, when we talk about that, and you know, we were talking before we came on the air, we're talking today, ladies and gentlemen, about pregnancy and infancy loss awareness, because the month of October is dedicated to that cause. And we're going to talk about some things. Let's talk about, let's kind of walk us through a pregnancy, if you don't mind. Someone that's getting the proper treatment versus someone that may need some additional treatment.
So generally, we like for folks to show up as soon as they know they're pregnant, so that we can begin prenatal care. Unfortunately, some early pregnancies will end in miscarriage. And so we want people to know that miscarriage occurs in 1 out of 4 women in their lifetime. So 1 out of 4 women will experience a pregnancy loss in their lifetime. And we don't always have great answers for why this happens. Sometimes it's underlying medical conditions, sometimes it's genetic conditions, or so many things have to line up just right when the egg and the sperm meet in order for us to have a normal, healthy pregnancy. So honestly, when you look at how an embryo is formed, you would be surprised that we have so many normal people walking around, because it takes a real, very detailed process for that to happen just right. And sometimes when it doesn't happen just right, the body will recognize that, oh, this is not going to be a successful pregnancy, and it will stop the pregnancy from growing and developing. And so, you know, that's a person that may be 8 or 9 weeks and realize that the baby no longer has a heartbeat on ultrasound. And so, you know, that can be a devastating loss. If you move further into the pregnancy, into 2nd or 3rd trimester, losses can occur just because of underlying medical conditions in the mom, or something that's happening genetically with the baby, or infection. There's so many things that can happen, and we don't get to control all of that. But what we want to do is when that does happen, that devastating moment does happen to a family, to be prepared to take care of them. And so we've undergone some training with the organization called Rachel's Gift, which is a nonprofit organization. And Rachel's Gift provides healthcare worker training on sensitivity, how to help these families live through this horrible moment, and how to take care of of these folks when they need us the most.
Wow.
They also provide support to the families, and they will do keepsakes, and they do photography if say we have a baby that's further along that passes away. We really work hard to make sure we're partnered with Rachel's Gift to offer support to these families. They have support groups. They have all sorts of supports that they offer, even a 24-hour hotline if parents are having a hard time dealing with a pregnancy, loss, or stillbirth.
Wow.
So it's a wonderful organization that we're glad to partner with.
Great. We're going to talk a little bit more about that in a moment. We were talking before we came on, how important is education in all of the things that we were talking about, getting that prenatal care, having access to, and we're going to talk a little bit about that, bridging the gap in just a moment. But how important, and what would you say to the listening audience right now, or someone that may be early pregnant and hadn't had the treatment that they should be getting? What would you say to them?
I would say, do your best to get in. There's so many factors that play into having treatment. One is, do you have health insurance? Do you have access? Mm-hmm. Is there an appointment available? Like, there's so many things that can go into that. Mm-hmm. Many times health insurance can be a big barrier, but I want to make sure that everybody knows that if you find that you're pregnant, that you can go to the Department of Public Health and actually get a form that would allow you to seek care with a doctor or a midwife or nurse practitioner right away. So there's no waiting period. You just go down there, they confirm that you're pregnant, and you can get a waiver that will allow you, and they will, of course, work on the back end to get you insured with public insurance if you don't already have private insurance through your employer or through the marketplace. So I want to make sure people know that, because people think that there's a huge, long process they have to do, and they may not, know how to navigate that, but you can go down there. They can help you get engaged in care and get some insurance going for you.
Very good, very good. We'll go back. You were talking about Rachel's Gift, and I think this is a young lady that suffered a tragedy.
Yes, Rachel's Gift was founded by Lori Beth Blaney. She was a mom who was involved in a serious car accident, and unfortunately, her daughter Rachel, who was a third trimester of pregnancy, did not survive. And during that process, it was so interesting because this happened at Grady, where I did all of my training. And she told me the story of how it happened, and she told me about this amazing ICU nurse who's still there at Grady. I worked with him for a long time, but she told me about the way that he cared for her and how he dressed the baby and brought the baby to her. She was immobilized because of the accident. She suffered some severe injuries herself, but he brought her daughter, and he dressed her up, and he wrapped her in a blanket, and he brought her so she could see her daughter and touch her daughter. She wasn't able to hold her daughter because of her injuries, but that moment, she said, meant the world to her, and he would stand there and hold her hand and just let her cry. He really provided great bereavement care to her, along with medical care. And she wanted all healthcare providers to understand how important that is, and how to be able to do that and come alongside these families and to think about the things that we say, the things that we don't say, just to be sensitive to what that individual and that family may be experiencing in that moment.
Wow. And that's the purpose of us being here today, because you guys are going to have, there will be a walk that will be held on October the 12th, Memorial Walk. Talk a little bit about that, if you don't mind.
So the Angel Dash is the biggest fundraiser for Rachel's Gift. It's my personal philanthropy. It's what I do every year. Because I understand what these families go through, and without organizations like Rachel's Gift, we wouldn't have the healthcare provider training that we so desperately need. Many of our families would not get the support and the keepsakes and the grief counseling that they need. So I just really love what Rachel's Gift does for our patients, and so every year I support it. And we're going to be at the Jim and Annette Boyd Complex on October the 12th at 2 p.m.
Okay.
And we want everybody to come on out. It's a 1 mile walk or run. I'll be walking, but if you want to run, you can come out there
go
and
ahead,
run.
right? Okay.
And we have so many great community sponsors. So many businesses have come out to help support this.
Okay.
And we want as many people that we can get to register. So you can go to angel-org and make sure you register for the LaGrange walk. There are like, I think, 19 different walks across the country. So make sure you hit the LaGrange button. But you can come as a in-person walker or runner, or you can come as a phantom participant. And so they will send you a beautiful commemorative Rachel's Gift shirt. It changes color every year. I think it's green this year, nice Kelly green. So we just want to be able to support this organization that provides so much support for West Georgia's families who are dealing with pregnancy and infant loss.
Wow, absolutely. And you know, you're talking about the sensitivity and the, you know, just the being able to be there to help them to grieve properly.
Right.
And I think this is a time to kind of celebrate as well as also grieve, would you say?
Right, absolutely. I think that many times when people go through miscarriage or stillbirth, people sort of want them to shut that pregnancy away, shut that baby away, don't talk about it, get over it, you can probably have another baby, that kind of stuff. That's not really appropriate. When you lose a pregnancy or you lose a baby, you're losing a loved one. And that's one of the reasons why we offer the opportunity for moms who have stillbirth, or maybe they have early infant loss. We want them to be able to touch and see and hold their baby. And so our staff is trained to actually dress the baby, to prepare the baby for the parents, let the parents interact with that baby, just like we do with our other loved ones. Like at a funeral, there's visitation, and you can spend time and you can sit there, and then there's a funeral. Well, many times for these folks who are dealing with pregnancy and infant loss, they don't have that opportunity to say goodbye or to grieve. And so that's really what we're promoting. And then they have a 6-month grief counseling program for families. So it could be moms, dads, grandparents, everybody who, you know, is suffering can actually participate.
Wow.
So there's so much that they do for our families and for our staff to keep us all up to par and make sure that we're providing the most respectful, sensitive care that we can in those moments.
Well, again, Dr. Beck, I just want to say thank you for all that you're doing here in our community, and we're so glad you came back too. And as we were talking before you came on, there's just, you have a plethora of stuff that we're going to have you back on to talk about.
I'm coming back. We got lots of stuff to talk about.
Do.
So many great things coming to LaGrange for women and children, and we're excited about it.
And we're going to help you get the word out. And not only are we going to do that, we're going to actually bring together individuals that will help us to get the word out, because I think it's too important, because we didn't talk a little about the mortality rate there. So I'm going to get the chance to talk about that, and then just some other things that we want to talk about. So definitely, this is a platform that you always have at your disposal. I'm just letting you know.
Thank you. Well, you know, if you invite me, I'm coming.
Yeah, that's right. Absolutely.
All right. So, well, I'm hoping everybody will go on out. Support the Angel Dash. So that's angel-org. You can register online. If you want to come out in person October 12th, you can do that too. We'll be out there. We're going to have a biodegradable balloon release. So we're going to write the names of our angel babies from the community, and then we will release those to heaven and let them know that we're thinking about them and honoring them and remembering them. So families are welcome as well. If some of our business partners didn't get a chance to be an official sponsor, we would also love to get gift cards or different services for a raffle. We'll have a raffle the day of the event. So we are very, very grateful to all of our partners in the community. We will have coping stations for families who, you know, may need additional counseling services. We've got some folks that will be there to help out with that. But we really just want to get together in community and support each other. We know pregnancy and infant loss can be very isolating for families, and everybody else is going on and having their pregnancy and their baby shower and their, you know, their kid, and you sort of didn't get to experience that for some of these families. So we really want to just support them, let them know that their community cares about them and that we're here.
What a great way to do that, and a great person that's leading that charge. Again, I just want to say thank you for being my guest today.
And thank you for having me.
Blot out another time next month, no doubt.
Okay, we got it.
All right, very good.
We'll be back.
Thank you very much, Dr.
Thank you so much.
All right. I want to thank you for joining for City Week this week. My guests have been none other than Dr. Joy Baker, as she talked about Pregnancy and Infancy Loss Awareness Month, which is the month of October, and more so, we talked about the Memorial Walk, Rachel's Gift, that will be taking place on October the 12th at 2 o'clock out at the Lafayette Christian Academy, the Jim Annette Boyd Athletic Complex on Hamilton Road. So come on out, walk, run, phantom if you like, but by all means, come on out and support this very worthwhile cause. Ladies and gentlemen, I hope that you've enjoyed this interview, and as always, I want to invite you back for more of City Week.